Hi, and welcome to In Brandon. We're down at the 7th Street Health Access Center, and with me is Chris Blakey. Welcome, Chris.
Thanks for having me.
And Chris is the service navigator here. So Chris is going to tell us all about what goes on down here at the 7th Street Health Access Center and what kind of functions and services you provide and what you do here.
Sure. So the 7th Street Health Access Center was open in 2005, and we sort of had a different idea when it came to healthcare, where we're sort of looking at the full picture of people. So we're meeting with people, we're talking about their income, their mental health concerns, their physical health concerns, trying to get sort of a whole package of what's going on. And then we can use our different services and our different service providers to kind of come up with a plan of what's going to help them the most. So sort of in the front lobby here, we've got computers that our clients can use, phones that they can make calls, including long distance ones. We've got all of the office stuff, the computer, the faxing, that sort of things, trying to make it a little bit easier for people to access some of those things that may cost money in other locations. Of course, everything we do here is free. We also have a phone system, so we do have clients that don't have access to a phone, can't afford a cell phone, that sort of idea, and we can give them a phone number. So if they're looking for employment or they're looking for housing, there's a place for potential employers or landlords to connect with them. In our building, we have a huge variety of providers that offer specific services. So home care, for instance, works out of our program doing wound care services. We have a community health nurse who is here 7 days a week. She can meet with clients if they have any health concerns. She runs our needle exchange program and is sort of the first line if somebody's not feeling well, what we decide to do with them. We have a clinical assistant and a nurse practitioner here that work pretty much like a family doctor. They can meet with people, prescriptions, they can prescribe tests, do blood work, that sort of thing. One of the other features is that our folks can actually meet with somebody who doesn't have health coverage. So if we have people that are here from another country visiting, or if somebody's had a problem with Manitoba Health and doesn't currently have coverage, they can look after them, and provide that sort of first care without any costs. We have two folks that work here from the Addictions Foundation. They run groups in our kitchen, and they provide addictions counseling. We have two mental health workers that work in our facility that provide things like help with anxiety, depression, stress, that sort of idea. We've got a community social worker who can sort of get more involved with clients, can accompany them to appointments, can help them with a wide variety of things, can work with families as well. And she also runs the AAA parenting program. We've got a dietitian that works out of our building too. So you can see our dietitian without being referred by a doctor. So if you wanted to take up bodybuilding or you're worried about losing weight, something like that, they could work with you and come up with a diet that fits your lifestyle and your goals. We also have a community, I can't remember her title now, sorry. We've got a consumer educator. It's somebody who works with clients that have mental health concerns that aren't really comfortable with the processes. So maybe they don't understand the medications, or they don't understand side effects, or they don't understand, what sort of happens. So if they've been given a diagnosis of like bipolar or something like that, that can be pretty scary for people and their families. And so she works with them, works with the families to kind of explain what's going on. We have a housing resource worker as well, who helps people find affordable housing. She works with landlords and has an idea of what sort of landlord is willing to take pets, what sort of landlord is more willing to deal with people that have addictions or mental health concerns. We also have two interpreters in our building, so we can handle our Spanish-speaking community and our Mandarin-speaking community. So they'll meet with clients with any of the providers in here. And we also have the ability to get almost any language that we need if somebody doesn't speak English. So in my role, I would be the first person that these clients would meet, and we would do an intake and talk about if they're working, where they're living, if they have any mental health concerns, physical health concerns, or addictions, and then I would work with them to try to figure out how we can solve some of their problems. The Brandon also has something that we call a ministerial fund that's provided by the churches and some businesses, and we can use that to help people in need, whether it's helping them get medication or helping them with some other goal that requires sort of a financial short-term solution before we can get longer-term things in place. We are open 7 days a week from 11 to 7, and we're only closed, I think, 12 days a year, just the stat holidays.
So are there any other facilities and stuff that are provided here, not necessarily within the health aspect, but just general services that are offered to people?
Yeah, no, certainly there is. We have some laundry facilities here, so clients can come and do laundry. We provide the soap, and it doesn't cost them any money. The last time I rented a home, we had coin-operated laundry, and it was $4.50 to do a wash, so it's getting pretty expensive. We also have shower facilities here, and so if somebody needs to use a shower, we can set them up. We have the soap, the shampoo, all the personal hygiene products, and we have a variety of people using that, from our homeless population to even people who've injured themselves and can't get into their home shower. Our home care folks will use that as well to help their clients if they need to. We also have a community kitchen, I guess. The kitchen is accessible by the public. We have different groups from the Addictions Foundation that run out of there, some mental health groups that run out of there. Westman Immigrant Services has used it for cooking classes, and there's some other groups in Brandon that have used it for cooking as well.
Excellent. So you got a great big wide variety of services and facilities here for people to take advantage of.
Yeah, we hope so. We kind of look at this place as a one-stop, and there's very few places where you could go, have your doctor take your blood work, have yourself a shower while you're doing your laundry. So we think we're pretty unique in Brandon when it comes to healthcare.
Great. Well, thank you for sharing this facility with us.
Oh, thanks again for looking.
All right. So another program that's run out of the 7th Street Health Access building is the Community Volunteer Income Tax Program. And with me is the lead of that program, Brett Turner. Welcome, Brett. So let us know a little bit about what this tax program is about.
Okay, well, Prairie Mountain Health and Income Tax, you might not see the fit, but basically there are 3 million Canadians that are living in poverty. And there was the World Health Organization have determined that income or standard of living is the greatest single determinant of health. It was reported in the CBC not too long ago that 250,000 Canadians are missing out on almost $175 million worth of benefits. And the reason that they're not getting those benefits is that they're not filing their income tax returns. So the health community has started to understand that income is related to health. The Community Volunteer Income Tax Program is a partnership between community organizations and the Canada Revenue Agency, where volunteers help low-income Canadians get their income tax returns filed. And by getting those tax returns filed, they get access to all the different kinds of benefits. The child tax credit, GST credit, working income tax benefit. There's, more than a dozen different programs that people get access to because of filing their income tax returns. The program, the Community Volunteer Income Tax Program, has been around since 1971. It's been operating in Brandon since about 1993, and it's been operating out of the 7th Street Health Access Center since it's originally opened. Last year, we did about 1,700 returns out of this building, and most of those returns were done by 6 or 7 volunteers. We also operated out of about 10 different smaller communities in Western Manitoba and did about 500 returns out of those communities. So I've started with Prairie Mountain Health just basically with the idea of trying to expand the program to different communities around Western Manitoba, and to try to attract more volunteers, because the program doesn't work unless we've got volunteers. So we're looking for people who have a basic understanding of income tax, and they're comfortable using computer software, and they're willing to commit a couple of hours a week helping out with the program. There's a couple of different ways that volunteers can help. If they were working at 7th Street, they could come in, sit down in this office, for example, sit with a client, go through their income tax return, file it electronically, complete everything while the client's sitting with them. Everything is filed electronically, and they're done. Another way that the volunteers could work is through drop-off programs, and that's how most of our rural communities operate. So the client comes into a location in a community, they leave their tax information along with a form that they fill out. The volunteer picks that package up and takes it home and files it when it's convenient for them, and then takes it back to that drop location where the client comes and picks it up. So, like I said, we're looking for people to volunteer. Specifically, we're looking for people in different rural communities, such as Boissevain, Melita, and especially northern communities like Roblin and Russell and Dauphin and Swan River. We're not the only ones that offer the program. In the north, there's a program operated by Friendship Centers in Dauphin and Swan River. And in Brandon, there's also partnerships between Revenue Canada and the Métis Federation, and also the Seniors for Seniors Co-op. Here at 7th Street, we start running the program 1st of March, and it runs for 2 months, so March and April, with people coming into the office. But it continues all the way right through until October, with clients being able to drop off their information.
Right. And is there any specific eligibility requirements, not for the volunteers, but for the people who are asking to have their taxes done?
Yeah, it's specifically for low-income clients. So right now the threshold is $30,000 for an individual and $40,000 for a married couple. And also, it's only simple income tax returns. So we don't do returns that have complicated situations. We don't do business returns. We don't do deceased returns. We don't do returns with capital gains or complicated. It's all simple tax returns, and basically for low-income people.
Great. Is there anything else that you wanted to?
I just would like to point out something, an example of the kind of difference that it can make for a person getting their income taxes filed. There's an example on the board here of a situation with a single parent with 2 children and having a modest income, $15,000. And I don't know if you can get a picture of this chart, but by filing their income tax, in this example, the person can get access to the GST credit, child tax benefit, working income tax benefit, rent aid, Manitoba child benefits, etc., etc. This person in this example, starting out with an employment income of $15,000, because of all these different benefits, can actually increase that income to $37,000. So more than doubling their income by filing their income tax returns. And I know people in situations like we find with the clients that are coming into this building have a tendency to maybe not trust the government or have issues with maybe having a debt of some sort. But we find in lots and lots of cases that just getting the income tax done is going to make a better situation. We had an example not last week or so, I think, where a person had a debt with Revenue Canada, and they were worried about whether they were going to, get into trouble. By filing their income tax return, they ended up with getting basically a huge refund and offsetting that debt and having money in their pocket. So it's worthwhile.
Great. Now, what about seniors?
Same thing applies to seniors. We've got another example on a different board of a widowed senior, not currently old enough to claim CPP, but working a small part-time job, earning about $4,000, $5,000 and getting a survivor benefit from CPP. So that's a $7,000 income, but filing their income tax and getting access to all the other benefits, increasing their income to almost $20,000. So it can have a huge effect.
Great. Well, thank you very much, Brett. Hopefully a lot of people will take in this information and take advantage of the program, or volunteer, which is really what we're here looking for too, is for the volunteers to come out and give their time if they have a little bit of tax knowledge, because it's not really, when you're doing simple the simple tax returns, it doesn't take a lot of, it's a pretty simple process.
Yeah, and with the software nowadays, the software is very user friendly. It's just a matter of taking the information and putting it into the computer, and it's not a difficult process. We specifically here are looking for people that are able to work during the day. If we could expand our hours that we offer the program, last year it was just 2 days a week. If we could expand that program to more days in the week, it would be a lot more beneficial. We end up, once the season starts, having lineups out the door, and people get frustrated with that. So with a few more volunteers, it would make a huge difference.
So again, let's just quickly recap the dates that your programs start for people to be able to bring in their tax returns here.
We think it's probably going, starting the program depends on Revenue Canada getting us the software. Normally it starts the first part of March. So I think it'll probably start the 5th of March and run right through until the first part of May. But again, the program doesn't end then. You can keep coming in here and do your return on a drop-off basis right through to the start of October. Lots of times people find out for the GST credit and the child tax benefit, they're always half a year behind. So in July, all of a sudden those things stop and they realize they haven't filed their tax returns. So we get lots of people coming in here after the 1st of July saying, holy smokes, I need to file my income tax return. So the program doesn't stop at the end of April.
So is there any support that Revenue Canada gives to either the participants or the actual volunteers?
Yeah, the volunteers basically have access to training from Revenue Canada through online webinars. We also offer a small training session to get the volunteers to understand the logistics of the program, how it works. But Revenue Canada does the training for filing a tax return. Also, when a volunteer starts, we try to make sure that they're paired up with an experienced volunteer to go through it, a few times to get comfortable with the process, with the software. And finally, if you're filing an income tax return as a volunteer, you get access to a special CBITP helpline. It's not the regular number that people would phone that they're standing in waiting in a queue for a long time. It's a CBIT specific helpline, and the Revenue Canada are really good at helping you out when you've got questions.
Right, and you're also saying that because you volunteer and input and everything into this program, you also have access to be able to do your own taxes.
Yeah, when you sign up to be a volunteer and sign up, they also want you to sign up to be an e-filer. And as that, when you do that, you get a copy of the U-File program, and you can use that to file your own and your family's, your immediate family's income tax returns. So, there's a benefit rather than going out and spending $40, $50 to buy the software each year. And you're getting the software for free and you can use it.
Great. And is there any liability to the volunteers because they're inputting somebody else's information if there's some minor adjustments or a little bit of errors or something on the return?
So when a client comes in to use this program, they're signing a document saying that they understand that the return is being filed by a volunteer. And then if there are any follow-up issues with that return, if something is keyed in wrong, that's all done between the client and Revenue Canada, and it's called an adjustment. So you don't file a new tax return, you file an adjustment to the information that's already done. So that happens once in a while, but there's really no comeback on the volunteer. You're there doing the return to the best of your ability. Sometimes mistakes happen, but there's no comeback on volunteer.
Excellent.